Hello, I'm EnterElysium and welcome to a beta impressions of Big Pharma. So Big Pharma is currently out in beta. Well, actually it's pre-release and you happen to get access to a beta. Yeah, basically it's pre-order with a beta access, but yeah, beta. And it's a game about economically managing a pharmaceutical company and with like puzzle elements. So it's kind of like an economic strategy game. I'm not particularly good at explaining things, but you'll see when we get into game. I'll be honest, I really kind of like it. I have played several hours so far, and I'm really kind of digging it. So let's go new game. So I've done the tutorials. It says I haven't done this one. I have done it. And there's a number of different ones you can do. So you've got stuff like crippling debt. You've got a quick start, advanced, intermediate, and beginner. I'm just going to show you the very basics, so get to grips with it and show you how the basic mechanics work of the game, and talk about how I'm finding it. So we'll just do the beginner. I'm going to do bottom line, which is have a revenue of $1 million in 10 years. So it's pretty easy. It's a pretty small map with only one competitor, and you get a decent amount of starting cash. I will be Jenny, and I'm Alicia Pharmaceuticals? I think it's spelled like that. I'm pretty sure it's got the word mace in it, so it must be a C. Yeah, Alicia Pharmaceuticals. Incorporate. Right, so this is the map. I think it's procedurally generated every time. We have 1, 2, 3 entrances to the current room we've got. It's not even like a room, it's like a section of room. We can buy more room if we want. So, I might do that, actually. Yeah, let's just buy this whole place. So, this is the area we have to work in. We need to produce drugs, and then sell them to the market and make loads of cash, and generally be fairly evil about it. At least that's how I play it. It's more profitable that way. So you have ingredients you can turn into drugs. So we currently have the frozen bioxy sap and the reformed Bantaday gem. I think this is also pretty random as well. So which one are we going to produce? So, having a look at the frozen bioxy sap, if we have a look at this, this is relieves hypertension, and this one is soothes cough. So these are the two effects that you can get. Basically, you can turn them into pills that reduce hypertension, and you can choose, you make a pill that like soothes cough. And we can have a look that, go away, there we go. So apparently the demand for this has gone up, although it does vary. It seems to dip in summer. Soothes cough. Well, of course, maybe you get more coughing in winter when people have like colds and stuff. So yeah, that would make sense. What about the frozen bioxy sap? You seem to get sort of a dip maybe in spring. The demand is pretty similar for both of them. In fact, the demand is 104% for both of them. 0% saturation. That means no one's producing a cure or even a treatment for it. So I think I'll probably go for the frozen bioxy sap. The reason for this is there are side effects to certain drugs. So if we have a look here, we've got induces nausea, and we've got inflamed skin. So these are two side effects, and they can't be removed. There's no way to remove them, so you have to kind of live with them in your drug, and this can make the cost of the drug go down, so it's worth less money, because people who take it happen to have side effects. So if we have a look here, we've got a current concentration when you get the ingredient of like a 5 here. We want to get it into a range of 6 to 13, so it'd probably just make the concentration 1 more. Make the concentration 6, and this would become active, so we'd suddenly have the soothe cough, and we could sell it as a drug that soothes cough. Currently it does nothing if we turn it straight into a pill. However, if we increase the concentration by 1, it also will activate, this is a 6 to 14, induces nausea, which currently isn't active. So we'd suddenly have a pill that we could sell that would have coughing and nausea as effects. And sadly, we can't get rid of removed nausea, so there'd be there are a couple of ways you can get rid of it, but you can't get rid of it by just removing the thing as per usual. Oh, I should pause the game. However, for the frozen bioxy sap, if we increase the concentration by 1 from 8 to 9, 9 to 13, this would become active. 10 to 18, this wouldn't become active. So we could actually sell a pill, the frozen bioxy sap, that we could relieve hypertension, but wouldn't have a side effect, which is pretty cool. Alright, so that would give us like a really good quality pill. So let's do that. So we need to increase the concentration by 1. So we need this, the evaporator. So there's several different machines. There's like 6 here. There are actually more, but since we're playing the beginner's version of the scenario, it kind of limits you in what you can get. I'm just trying to explain the basics. Don't worry, there are plenty more things in the game. But for now, we're just going to go with the evaporator, which increases the concentration by 1. By the way, these are grayed out because they aren't unlocked. We'll unlock them in a minute. So let's get the evaporator. We'll put that in... I'm thinking... here. Let's get frozen bioxy-sap. Import. And then we need a maker. So that'll increase the concentration by 1, which will make active. So let's put the pill printer. I could put pill printer like that, but I'll show you why in a minute I'm not going to do that. So let's put the pill printer here. Boop. There we go. And let's unpause. So this will import the good. Frozen bioxy-sap. And suddenly you see this becomes active. See? It's gone at 1 concentration to 9, and this is now in the active concentration range. It's turning it into a pill. And here we go. The Quarpian pill. Processing cost of 30, 10 for that, 20 for that. Raw material cost of 36. And we can Elysian hypertension ease, name it. Start selling it. Now you realise here that we're actually getting a one flow through this, but this is actually being held up by the fact that the pill printer is a process time of 2, compared to that with the process time of 1 for the evaporator. So if we put in an extra pill printer here, we can actually get these. Wait a minute, they're out of sync! No! I don't like it when they're out of sync. Okay, let's try and get this in sync again. They're not in sync. Why are they not in sync? Right, we can solve this. Come on. Right, there we go. Come on. Crippling OCD. There we go. Now they're in sync. Excellent. And so it's producing a pill with no side effects, but which has relief hypertension. So it should be a fairly good quality pill. And we're now selling this. If we look at our company, you can see that we have cure rating of C. We're probably going to get 30 per month, I think, since months of 30 days in them. We're selling 1 per day. Current value of just under 120. Current profit 55 because it costs about 75 to make. 65 to make. So that's a fairly good pill to sell. What are you selling? They're selling a cough reliever, which is good because we don't have any competition in the market for our hypertension ease, which is nice. So let's go back to production. And you can see that we're selling that kind of nicely. So, what else is in the game? Well, like I talked about these 2 ingredients up here, you can actually unlock more ingredients. And you can unlock a new biome, the desert biome, and go look for stuff there. We don't have that unlocked at the moment. You can unlock that with research. So let's go unlock a new ingredient of some kind. Now, what's this? Using psychological medication and also has a catalyst. Now, catalysts are used to upgrade certain drugs. So certain drugs might be like, to upgrade this, you'll need a catalyst. We're probably not going to get onto that in this impressions video, but it's just worthwhile bearing in mind that there are more than just what I'm going to talk about for upgrades. So let's go and hire an explorer and send you to uncover the Tumblewoad. And let's also do some research. So there are a couple of more machines. We've got the ionizer over here and the agglomerate over here. Let's hire 2 scientists. Boop, boop. There we go. And these should be able to unlock these. So this is a research tree. So by hiring scientists, you can do the research. We need to get these 2 machines. A couple of reasons. Firstly, they're useful. They increase and decrease concentration by 3. This one is decrease, this one's increase. Also, they're needed to upgrade certain drugs. So if we have a look at our ingredients, actually no, cures, we can have a look at these here. This one needs an ionizer to upgrade to the next level, and this one needs an agglomerator to upgrade to the next level. So we need these machines to create a second level drug. Now, second level drugs need more machines to get them there, but they also have these cool things like, more price. So this one, you got a net demand of 105%. This one's 93, and this one's commanding a pretty decent price. So to do the upgrade, we would need to take the Soothe Cough ingredient and get it to 8 to 11 concentration, and then use an agglomerator on it. So we need to get it between 8 and 11, and then agglomerate it. So let's have a look at the Soothe Cough. is already... Oh, it's at 6. I thought it was an 8. Sorry, that one's 8. We need to get it to go up 8, and then use an agglomerator on it. Interesting. But unfortunately, we don't have the current... what they called? Machines unlocked. So we don't have the current machines unlocked. So let's just fast forward. So I'm going to show you the second level. Now, if I was playing properly, I'd probably build some extra machines right now to get me some monies. Actually making a loss. Uh-oh. Maybe I should build something just to avoid getting a loss. I could always get a ridiculously sized loan. Yeah, let's build something. So it's a decent profit on that. I think what we'll do is maybe build... I don't know what his profit is. Maybe we'll build a second one of these. So let's just copy the production line entirely. So it'll be import. Yeah, import. Not upgrade, sorry. Import. I'll talk about upgrades in a minute. Basic, evaporation, maker, pill printer. There we go. Hopefully we'll be able to sell that for a little bit more cash, because currently we're actually losing quite a lot of money. That's a lot of money. It's because we've got our scientists and our explorers out in the field at the moment. And then they're out of sync again. Stop being out of sync. It annoys me. There we go. Right, so hopefully we can sell those, make a little less of a loss. Still making a bit of a loss, but that's because I didn't start researching and exploring for new ingredients straight away. We're up to 37% there, so we're not going to get that particularly fast. %there. Maybe we will make a cough cure. Which is only at 26% saturation, whereas this is, we've got it up to 72. Yeah, we'll do that. So that one needs to be increased by 1 as well. So that's a pretty simple case of basically doing what we've done already. Quickly find ourselves an evaporator. Maker, pill printer. And then import. We'll import the reformed Bantaday gem. Not upgrade, import. God damn it. And then we've got our new pill. So it's automatically named. It's named the Elysia Chesty Cough Stopper, this one. These names are basically dynamically generated. It checks what you're making, and like I'm making a pill that does soothes cough. It goes, okay, and we've named it. So I kind of like those. Those are kind of cool names. And yes, they're in sync. Awesome. And we're now making... Oh, I thought we were making a profit for a second. What's our operating costs on them? We're getting profit from both of them, so both of those are profitable. And that actually popped down in cure rating temporarily. Oh, it's down again. And we finally... Right, okay, right. We've done our research and we've got our new ingredient. So if we check our ingredients, you'll see that we have this. Ooh, the Continental Bioxy Pieces, which we can use as an antidepressant if we get it up to between 15 and 20. Okay. However, it also comes with 3 side effects, not just 1. Now, 2 of these side effects we can get rid of. One of them with the ionizer. If we run it through an ionizer at 12 to 14, it starts at 13. It will get rid of the causes random fainting, which is kind of nice. This one we need to get up to 14 to 16. So yeah, we could increase it by 1 concentration, which would take it to the 14, which both of these are, and then run it through an ionizer, which both of these want, and that would get rid of both of these effects. Also, the effect, the antidepressant we're looking for, is a 15 to 20. If we look at these, none of these are above 16. So we could get to 17, so increase it by 4, and none of these would be active, but antidepressant would be, so we could then sell an antidepressant. Alternatively, we can sell it with the side effects, which is cheap for us to make, and maybe it's more profitable to do it that way. It won't be as good a quality drug, because it's a load of side effects, but it would probably be profitable. So, let's go have a look at our research. So we've got the agglomerator, and we got the ionizer. So this allows us to make second-tier drugs, which will be pretty cool. Let's look at our cures. And the antidepressant can actually be upgraded with the dissolver, which is interesting. So, by using the dissolver, we can make a combat's ADHD. So, if we were to use the agglomerator on the ionizer at 0 to 6, or 8 to 11, for either of the ingredients here, it will make the treat angina or eases asthma. However, look at the amount of money we get for combat's ADHD. However, we need a catalyst. Now, correct me if I'm wrong, but it actually comes with a catalyst. So, continental bioxy pieces, comes with a catalyst involved. Now, normally when you want to make an upgrade that has a catalyst, you have to mix two ingredients together. Luckily enough for us, our ingredient we want to actually turn into a second level drug comes with a catalyst already in it. So we're good. So let's take the antidepressant and turn it into a combat's ADHD. So it starts off, we need to get to between 7 and 11 and run it through a dissolver. It starts off as a 13. Okay. So we need to decrease it by 2, run it through a dissolver. So dissolver, 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 because each of them decreases it by 1. Now I've got to make sure not to run it through an ionizer between that concentration, because it will get rid of this effect, and I need this effect because it's got the catalyst on it. So that's 3 dissolvers. Let's get the dissolvers out. So this is a dissolver. Where am I going to put it? I'm trying to think where to put this. Here, 1, 2, 3. So, bam, bam, bam. And this is going to be worth a lot of money. So let us import it. And we should see upgrade. So, there we go. And you can see that we are now, it's got the catalyst, and it says 7 to 11 run through a dissolver. And we should see it. There we go, it says 7 to 11. It's on 11 now. Run it through a dissolver, and we should see upgrade. Ta-da! Combat's ADHD, right. So now we can use it to combat ADHD. We can upgrade it again to treat bipolar disorder with an ionizer, but we need a catalyst with like the tri symbol. We don't have a catalyst like that. And we'd also involve mixing it, which we need a mixer for. We don't have a mixer, so let's just upgrade it to 16? Actually, this is active at 16. If we go to 17, this won't be active and we'll have no side effects. So we need to increase this by 7. So we can use an agglomerator. The agglomerator, let's look. There we go. Increases concentration by 3. However, the process cost is 35. Now its advantage is it's, a 1 by 2. Small floor space. Alternatively, for 10 a pop, we can increase concentration by 1 with the same floor space. So the agglomerator costs more than, say, 3 evaporators, but it takes up less floor space. I'm actually really starved for money. I think I'm going to have to take a loan. So I'm going to build the evaporator. So we need, what, to increase it by... How much? We're on 10? We need to go up to 7. Yeah, so we need to go up 7. So we need 7 evaporators. So 1, 2, 3. Where next? 4, 5, 6. Seven. And then we need a pill pusher. Pill printer. Too much. It costs too much. We can't afford it. Right. This pill will make us a lot of money, though. So the choice is I can take out a loan. So you've got loans here. Pretty high interest rates. 19, 12, 14. This one's pretty, low. So it's 2-year term, daily payment of 39, only 25 grand. This one is actually pretty tempting to take because it's a pretty small loan. The alternative is I could sell some of my machines on some of the other things. Or I could just repurpose them. Yeah, let's do that. Let's repurpose them. This is cheaper. So 1, 2, 3, 4, 5. I need 2 more. Where are you? Right. Oh god, I didn't mean to delete that one. That's going to be expensive. Not the agglomerator. There we go. 1, 2, 3, 4, 5, 6. 7. Now I need to build belts, but I don't have enough money, so I'm going to have to find some more cash somewhere. Temporarily deleting 1 pill printer should probably get me enough cash. So... Boop. There we go. Oh, I don't want loans. I specially made this so I don't need loans. So this drug is going to go through a pretty long processing procedure, which is going to cost a lot of money, but it's going to be worth a lot. Looking at the cure. Where are you? It's going to be worth almost 400. Almost 400. So you look, our debt's racking up pretty high now, but we'll sell this and we'll get a load of money, don't worry. Right, here we go. Name me! Elysia ADH Reducer, and see, none of these are active because it's outside the range, but the Combat's ADHD is active. Name it. And they're out of sync, of course. But look, we're making money! And I completely, like, ruined this. We don't need this ingredient anymore. Stop importing it. We're making a lot of money, actually. So we can put that pill printer back in when we can afford it. Come on. There we go. Now, while we're actually making money, it's worth noting some of the other things you can do. So, I haven't been using my Explorer. So, my Explorer's not been actually, exploring. So, they've generated a ingredient upgrade point, and you can use this to basically cheapen the cost at which you get ingredients in. So, I'm going to cheapen the cost of the bipoxy pieces. Reduce the cost by 10, so effectively that reduces the cost of getting that in by 3 for the raw ingredient, so we get more margin, we can make more money on it. For research, similar thing happens, we've generated 2 research points and we can spend these upgrading things. So I'm going to upgrade the pill printer, and these do different things for different things. So the pill printer, we get a pill bonus of, instead of plus 20 value for every time we make a pill, it makes a value increase of 23. And the pill printer, when I fully upgrade, is actually pretty decent, but it's not actually that decent when you get, the early creamer. The creamer is actually a better, I don't know what you call it, delivery mechanism, I guess, making a cream rather than a pill. We've got 2 points. I'm going to upgrade the pill printer again. There we go. It costs 26 extra. You can also upgrade things like the evaporator to decrease the processing cost. Same for these. And that can make it a bit more viable. So you can also unlock things like the multi-mixer, which allows you to mix ingredients together, the shaker, which changes how you mix them together, the creamer, which is a different delivery mechanism. The creamer reduces the strength of side effects of drugs. So if you've got like a drug with like some nasty side effects in it, you put it through a creamer and deliver it as a cream, the side effects aren't as bad. And you can do, other things like unlocking the autoclave, which halves concentration, the cryogenic condenser, which doubles the concentration. Although, by the way, like the pill machine down here, and the mixer, and the mixer, they have speeds of 2. They're incredibly slow, so that's annoying. You can also unlock things like desert expeditions, and I think there are more things that aren't here because it's a beginner. There are more machines. There's also, I think, underwater biomes and stuff that we don't have here because this is a beginner again. So you can do, a fair amount of research. There are a lot of ingredients. I mean, this is without the underwater biomes. There's plenty of ingredients to research, and there's that little try upgrade thing that we could get. So we need 4 explorers to do that, which will allow us to upgrade our Combat's ADHD to a treats bipolar disorder, and we make a lot of money off that. But we need a mixer as well. So this is just a quick sort of impression of there we go, Big Pharma. I really, really like it. I really like Big... Why are you out of sync? That's it. Stop being out of sync. I really, really like Big Pharma. It's got these sort of puzzle elements of how to lay out your floor to get the sort of the best, value for your space that you've got. at the same time as having this sort of economic strategy. And if we have a look at these up here, stuff like they've released a cough reliever, hypertension helper, which is going to definitely compete with our hypertension helper. This is a D quality. Current value 108. Same. So they're producing probably exactly the same drug as us there. Oh, look at that. Current profit. There's so much profit on this drug. It's a B quality as well, which gives it a drug value plus 10. B plus 20%. This drug is so good for us. This is really, really awesome. The fact that we could upgrade it straight away, and it already had the catalyst in it to upgrade, is pretty nice. No correlation. A recent study suggests there's no correlation between relieving hypertension and reducing the risk of heart disease and stroke. It makes hypertension medication less popular. So we should see, if we have a look at the hypertension, cure. There we go. Demand's decreased. What's this? Lung reducer. Yeah, whatever. I don't care. So now, as time goes on, we've got a lot of money from that. Oh, God, that's so good. We could, say, get more ingredients, do more cures. We can make, some maybe, more tier 2, so that's certainly worthwhile. Although, in some cases, if you look at, the processing cost, a tier 2 might not be worth it. You might have, a really in-demand tier 1. It's just amazing, and you could be able to sell that for a lot of money. As it is, we've got an amazing tier 2 here, a really good tier 2. We're very lucky to get this one. Normally, sort of tier 2s sit around, sort of 250, 270 mark. Almost 400, really good. So you could unlock more ingredients, do more cures, and bear in mind that there is a saturation of the market. If we check Comet's ADHD, we could probably double our production line, and we'd still not have saturated the market too much. And that's probably what I'd do right now if I was to be playing properly. I'd just double the exact set we have. Just make sure you get the right amount of market saturation. Not oversaturate the market, but get enough. We could also research more things. I'm just going to upgrade my pills. Unlock new biomes. Definitely get some more machines, because higher upgrades and stuff will definitely need stuff like the multi-mixer, and certainly, tier 3s tend to want to use a cryogenic condenser or an autoclave if they don't want you to mix something. And they allow you to create more expensive drugs. So this one's like 800. I really, really dig this game. So things that currently aren't in the game but will be in the game at some point, this is of course a beta early access type thing, there will be a advertising system. It's not really advertising, it's clinical trials. So you can do big or small clinical trials. If you do big clinical trials, they're more accurate about what your drug is. So if you're selling a terrible drug and you do a big clinical trial, it'll be like, yeah, your drug is awful, and demand will go down. If you're doing like a really good drug that's like a good quality, like we have a good quality drug at the moment, B+, if we were to, say, do a clinical trial of that, make it a big clinical trial, the results are very likely to come back indicating that it's a really good quality drug, and people want it more. Conversely, if you have a really crappy drug, and you take a small clinical trial, it's less accurate and will sometimes go, yeah, this is a really good drug, even when it's really crap. And that'll boost the sales of it. So what you could do is produce like a really crappy, cheap drug that's awful, and then do, oh my god, we're an A? Excellent. Well, I'll talk about this in a second. But you could, then sell it for, loads of money because people want it and it's got great advertising even though it's awful, and you just did a small clinical trial that incorrectly indicated stuff. So, there's that. But, here's the downside, by the way. If you get like a really good quality drug, if it's like A-star quality, it can cure people. And if you cure people, they no longer need your drug. Yep. You can cure people and make it bad for you. So as a pharmaceutical company, you want people to be dependent on your drugs. You don't want them independent. You don't want them cured. You want them to just keep seeking treatment. I actually developed in one game I was playing, I developed a liver disease cure. And it cured everyone. Everyone took it and it was amazing. It cured them. And I was making loads of money from it. So I produced loads of it. I oversaturated the market with it. And everyone got cured. And suddenly demand plummeted. Demand went down to 16%. And it was originally like 100 something. Because people were cured. And only people who've just got liver disease and take it for the first time would need it. So you don't want to cure people. And this is where the evilness of being a pharmaceutical company comes in, is you don't want to cure people. Because you want them dependent on your drugs. Which I find is a kind of cool aspect. Now there's also going to be a sort of an espionage system. It's not going to be a particularly big one, but it will allow you to sort of look at these drugs and be like, right, I want to find out how they're making this. And you can then, go and find out, and depending on how much you put towards it, you can find out exactly how they're making a drug. So you can find out the exact setup of how they're making a drug. You'd be like, right, these are the machines they're using, and you could reproduce that in your own laboratory and then produce exactly the same drug. And there'll be a patent system, which kind of, I think, works very much in synergy with that. And you can basically go, right, this is how I make a drug. So right now, I've got an amazing drug. I don't want to patent this. And if you patent it, no one can produce that drug. Well, not with that formula. But, because if you find out exactly how someone produces a drug, if they haven't patented it, you could do the exact same, and then patent it. So, this is a kind of cool system. I kind of like it. Let's look at cures briefly. Demand is still 103%, so... Oh, there we go, we have cured someone. We're permanently curing people. Now, because I'm an evil pharmaceutical company, I don't want that happening. That is bad. So what I'm going to do is I'm going to deliberately hobble my cure to make sure people will continue to need it. I'm going to increase the concentration by 1, and that should get it away from peak concentration. So let's talk about peak concentration. That's annoying. Go. Shoot. There we go. There's peak concentration. So, somewhere in here, we don't know. You can analyze it using a machine called the Analyzer to find out. We haven't got that unlocked, though. There's a peak concentration. And the closer you are to peak concentration, the worse the effect of the side effect. And the closer you are to peak concentration on the actual good effect, the more effective the drug is. So, currently my drug is too effective. I'm curing people. So I'm going to stop producing that drug, and I'm going to produce this new drug. And it's out of sync again. God damn it. Ah! Come on, get back in sync. There we go. So this peak concentration is you can try and get your drug towards peak concentration, and you want to try and get away from the peak concentration of the side effects. So I know probably for a fact that there is the peak concentration. So I've moved it 1 to the right, just to make it slightly less effective and not cure people. Because I don't want to cure people. Curing people is bad. So we have to get rid of that drug, even though it's making us a lot of money, because it would eventually cure people, and then, you know, people wouldn't need our drug, and the demand would go down. So the price would go down. So hopefully we should see that our new drug is not going to be curing people. So 2 people have been permanently cured. Ooh! But it wasn't by us! I should have checked. It was actually by our competitors who were producing a very similar drug. Well, there we go. That's the mistake you should not make. So I'm going to end this here. It's a great game. I really, really enjoy it. I find it a lot of fun. I'm definitely looking forward to it. I'm going to make a series on my channel about this. It might come out pretty damn soon. But I really, really like it. There's, you know, a lot of thinking about how you're going to best do it, how to best combine ingredients, whether it's worth getting rid of certain side effects, being an evil pharmaceutical company, not wanting to cure people. I'm really, really enjoying this game. So, you know, if I've gone over things a bit fast for you, then, you know, watch the series or whatever I do, or whenever I play it more, and you'll see a little bit more in-depth gameplay, especially with some more machines at harder difficulties, etc. And maybe we'll unlock, you know, the multi-mixer by getting basic auxiliary. But I'm really digging this game. So I've been EnterElysium. If you enjoyed this impressions video, please remember to like. If you're not subscribed, please consider subscribing. That way you can see more, and especially the playthroughs I'll be doing of this, because ooh, it's fun. But until then, stay shining.